Welcome everyone. Today in my channel, I am preparing a slide on medical and surgical nursing important MCQ question for easy exam preparation. I wish you all the best. Coming to the very first question, a blockage in which of the following artery oblique vein may lead to heart attack? Option number 1, pulmonary vein. Option number 2, pulmonary artery. Option number 3, coronary vein. And option number 4, coronary artery. The correct answer is option number 4. Heart attack happens when the flow of oxygen-rich blood to a section of heart muscle suddenly becomes blocked. It usually happens if the coronary artery is blocked and can't get oxygen supply. The next question is, what causes osteoporosis? The option number 1, lack of carbohydrate. Option number 2, lack of vitamin D. Option number 3, lack of protein. And option number 4, none of the above. And the correct answer is option number 2, that is lack of vitamin D. The main concept of osteoporosis is characterized by reduced bone mass, deterioration of bone matrix, and diminished bone architectural strength. So, when there is a lack of vitamin D, the bone become progressively porous, brittle, fragile, and they fracture easily. This condition is known as osteoporosis. Now, I think it's become clear to everyone. The next question is, what should be the immediate action in case of severe bleeding? Option number 1, apply pressure to the wound. Option number 2, call for medical assistance. Option number 3, put a dressing over the wounds. And option number 4, cover it with a pad of soft material. And the correct answer is option number 1, that is apply pressure to the wound. Proceed to the next question. Which of the following is the cause of heart attack? Option number 1, increased in cholesterol levels of body. Option number 2, when a blood clot enters to the arteries. Option number 3, when insufficient blood reaches to the heart. And option number 4, all of this above. And the correct answer is option number 4, that is all of this above. Proceed to the next question. Name the two endocrine glands which secretes their hormones when they receive order from the pituitary through its hormone. Option number 1, adrenal and pancreas. Option number 2, thyroid and testes. Option number 3, adrenal and ovary. Option number 4, that is pancreas and ovary. So we all know the endocrine systems and its regulations. So the correct answer is option number 2, that is thyroid and testes. Here a pictorial representation of major endocrine glands, that is starting from pituitary glands, thyroid glands, pancreas, adrenal glands, ovary in female, testes in male. So all these are the major endocrine glands of a human system. Proceed to the next question, that is arthritis is a disease of dash. So the option are question option 1, that is skin, option 2 kidney, option 3 liver, and option 4 joints. The correct answer is option 4, that is joints. Arthritis is the main disease of our joint. So when there is a swelling and tenderness in our joint, so we call this condition as arthritis. There are the two major types of arthritis, that is osteoarthritis and rheumatoid arthritis. Proceed to our next question, that is conjunctivitis is an infection primarily related to dash. The option number 1, stomach, option 2, knee, option 3, eye, and option 4, heart. So you all know that conjunctiva infection is known as conjunctivitis, and conjunctiva is this part of our eye. So correct answer is option 3, that is eye. Proceed to our next question, that is excess urinary acid, that is uric acid in the blood is an indicator of dash disease. Option 1, arthritis. Option 2, rheumatism. Option 3, gout. And option 4, rheumatism, heart. The correct answer is option 3, that is gout. Coming to the next question, a sac is formed when a weak part of a blood vessel wall bulges out. What is it called? So option number 1 are atherosclerosis, option number 2 aneurysm, option number 3 anastomosis, and option number 4 that is arteriosclerosis. The correct answer is answer number 2, that is aneurysm. So aneurysm is a widening of a part that develops from weakness or destruction of the medial layer of a blood vessel. Coming to the next question, what will you do when caring for a person with epileptic seizure? Option 1, anything that hurts in the vicinity will be removed. Option number 2, make a ball of cloth and place it between the teeth of the victim. Option number 3, will hold that person so that he does not move. And option number 4, all of the above. So you know do and don'ts when a person suffering from epileptic seizure. So the correct answer will be our option number 1, that is anything that hurt in the vicinity will be removed. Coming to the next question, at what angle is the intradermal injection to be given? Option number 1, 15-degree angle. Option number 2, 30-degree angle. Option number 3, that is 45-degree angle. And option number 4, that is 90-degree angle. The correct answer is option number 1, that is 15-degree angle. Our next question is, the difference between systolic and diastolic blood pressure is called dash. Option 1, blood pressure. Option 2, pulse pressure. Option 3, apical pressure. And option 4, lateral pressure. The correct answer is pulse pressure. So we all know that pulse pressure is the difference between systolic BP and the diastolic BP. And our normal blood pressure is 120 by 80 millimeter of mercury. So there will be subtraction from 120 to 80, and the pulse pressure will be 40 mm of mercury. Proceed to the next question. A patient is returned to his room after an esophagoscopy. Before giving fluid, the nurse should prioritize the patient's assessment of option number 1, level of consciousness, option number 2, TPR and blood pressure, option number 3, urine output, and option number 4, that is gag reflex. And the correct answer is option number 4, that is gag reflex. So proceed to the explanation, that is esophagoscopy is a diagnostic procedure to examine the esophagus performed under local anesthesia before giving fluid. After this procedure, the nurse should assess the presence of gag reflex. So fluids are not given in the absence of gag reflex because they can cause the aspiration of fluids and lead to respiratory obstruction. Proceed to our next question. The medium of anaphylactic shock is option 1, histamine, option 2, cytokines, option 3, dopamines, and option 4, adrenaline. The correct answer is option 1, that is histamine. Explanation is, with anaphylaxis, histamine concentration in the blood increases rapidly. So, what happened? In anaphylaxis, histamine, that is H1 receptor, stimulates can mediate vascular permeability, smooth muscle contraction, and tachycardia, whereas H2 receptor stimulate can mediate mucus secretion. Stimulation of both receptor can mediate vasodilation and reduce peripheral vascular resistance. And the last question is, which test is not used to diagnose neurological problem? Option 1, EEG, option 2, ECG, option 3, CT scan, option 4, lumbar puncture. So this is the question for your test. So please write the answer in my comment. Thank you.